Thank you very much, Presiding Officer. And at the outset, I'd like to refer members to my register of interests as the Vice Chair of Moving On Inverclyde, a local addictions service. And once again, I'd like to invite the Minister to actually go and visit the service. I also know that Paul Kane visited the service earlier this year, and certainly was very impressed by the work of the staff, their expertise, and also the organisation as a whole. And I know that certainly did go down very well with all the staff and with the board members. But like others, I have previously raised the issue about stigma in the Chamber. It's undeniably one of the key barriers to helping people living with addiction. I welcomed the planned stigma action plan, and I will read it carefully when it's published. And I'm sure that I and others will have questions about it when it's published, and I trust it will actually help towards challenging the stigma that people with problem drug use actually face. Fundamentally, I believe a societal change is needed when it comes to the issue of stigma. As the Chamber has debated before, tackling stigma head on is vital so that people can actually move towards recovery. Problematic substance use is a health condition, but the stigma associated with it can have that detrimental consequence for the individual, but also for their families and also the wider community. Now, for example, people may not acknowledge their problem for fear of being judged, and as a result, not actually go and want to seek the help and the support that they need. The Drugs Deaths Task Force, which the Minister has spoken about, developed a stigma charter that all organisations, including businesses and community groups, can use. And this aims to create a Scotland that is free from stigma in order to support a public health approach to problematic substance use. So, Presiding Officer, I welcome the National Mission and the £250 million funding over this Parliament. In particular, I welcome the move to a 5-year funding cycle for eligible third sector and grassroots organisations that really are at the forefront of saving lives. This is something that, once again, that I and others across the Chamber have highlighted in previous debates. The partnership working is vital to help provide solutions to help those with addictions. And I know that third sector organisations are crucial in that service delivery, not only from the organisation I'm involved with, but also from other local organisations in Inverclyde, but across Scotland. Therefore, the 5-year funding cycle for organisations will be hugely important in helping them plan their services and also how they can help with the issue of dealing with stigma. Every drugs death is a tragedy, and I put on record my condolences to the families of those who have sadly lost a loved one. And during Recovery Month in September, I attended a number of local events, with the most poignant being the Candlelit Vigil held in Greenock. Well, primarily about providing a space for people to remember those who have lost their lives through problem substance use. Attendees heard firsthand some of the real life stories of those who are in recovery or are still living with drug dependency. I mentioned this event as one of the key points raised that evening was the issue of dealing with stigma. The stigma is damaging, as I said a few moments ago, not only to the individual in terms of their mental health and sense of self-worth, but it does also discourage them from coming forward. I know that the Drug Deaths Task Force has developed the stigma strategy, which identifies actions that will help reduce stigma. The task force members with lived and living experience are also leading the development of a stigma charter that will challenge all of us to consider how we can work together individually to create a stigma-free Scotland. However, Presiding Officer, dealing with stigma is, in my opinion, one of the key issues we as a society face in dealing with problem drug use and how it affects every single community in the country. Now, I don't disagree with Labour's amendment with regards to stigma disproportionately impacting on the most deprived communities, and also agree that tackling the issue of poverty, deprivation and health inequalities is also crucial. I need to highlight, though, that drug dependency can affect anyone. We know that certain factors like adverse childhood experiences can impact on someone's likelihood of developing problem substance use, but it's also not always as clear-cut as that. I know that in recent months, a growing number of people living with alcohol dependency have actually presented at Moving On Inverclyde. I welcome the reduction in drugs deaths reported in Inverclyde from 33 to 16. However, this is still 16 deaths too many, Presiding Officer. But one thing I have witnessed locally is the growing partnership approach that really is taking place. Now, much of this came about as the Inverclyde drug strategy changed a few years ago, and it's become far more inclusive and recognises what the public and third sectors can bring to the table together to actually help save lives. This can only be a positive when dealing with the many economic and social challenges Inverclyde actually faces. But I do have a concern, however, Presiding Officer, that with the cost of living crisis and the many economic challenges ahead, that we may see a return to a number of increasing deaths. I certainly hope that I am wrong in that. Now, finally, on the point of the Tory amendment today, just one point I want to highlight, and that's the issue regarding the proposed bill that's been spoken about today and also in the past. Instead of playing politics on such a vital issue, I suggest that the member who wishes to bring the bill forward goes through the parliamentary process, then publish the bill, so that every single one of us in this chamber can read it, and then we can make up our own minds. The detail of any bill is important, and asking for a blanket support of something without reading the details is frankly taking the public and those who need the assistance for granted. Presiding Officer, Angela Constance has been consistent since she became the Minister. The drugs deaths crisis Scotland faces was not going to be solved overnight. The rollout of the national mission and its local implementation are vital, therefore, to saving more lives, and tackling stigma will play an important role in delivering that outcome.
Thank you, Mr.